PG Doctors NEET It's your YouTube channel.
Hi doctor friends, welcome to my YouTube channel PG Doctors NEET. Today's topic is Psychiatry MCQ. This is very important topic which are most commonly asked and repeated many times in the previous NEET PG exam and also in the all type of the medical PG exams. So this is very important for you, the upcoming exam. So let us start without wasting of time. Before starting, please subscribe my channel and watch till last. First question is the schizotypal personality belongs to which cluster of the personality disorders? The option given A, B, C, D type. Before going to the right answer, the schizotypal personality. The first of all, the personality disorder. If you define the personality disorder, this is of three types: A, B, C, and some books give A, B, C, D also. But you have to remember only three: cluster one, and called as cluster A, cluster B, and cluster C type. So the A, B, C type. The first belongs to the S, S, P. S stands for size-wide. S stands for size-wide. Size-wide and schizotypal. Another schizotypal. SCHI. Schizotypal. And another P stand for the paranoid. Paranoid. And the B type. Cluster B. Cluster B includes the borderline personality disorder, borderline. Next, dissocial, antisocial. That means antisocial, which are dissocial in nature. Dissocial in the nature. Another is the narcissistic. Narcissistic in nature. And the cluster B belongs to the dramatic behavior, like emotional behavior, erratic in nature. So the cluster B type of the personality disorder, which have the dramatic in the nature, emotional in the nature, and dramatic nature, emotional nature, and the erratic nature. And while that the cluster A personality disorder have odds behavior, eccentric behavior. So cluster A includes odds behavior. You have to remember odds behavior and eccentric behavior. Eccentric behavior. And cluster B includes dramatic, emotional, erotic behavior. And the another one is the cluster C type. Cluster C types include anxious in nature and fearful nature. Anxious and fearful nature. Fearful nature. And this includes anxious, that means avoid act, dependent, and OCD. Most common example of the cluster C type includes OCD. This is the most common type of the cluster C personality disorder. So here given the schizotypal personality disorder, that means these are the belongs to A option. I'm going to repeat it many times one thing due to it is very important for you that can you easily remember and revise many times in the single watching the video. The definition of the personality disorder includes the personality disorder is a type of definition. Personality disorder is a type of disorder mental disorder in which patient have a rigid and unhealthy pattern of thinking and functioning and behaving. This is the definition. Mental, again I repeat, mental sorry personality disorder is a type of mental disorder in which patient have a rigid and unhealthy pattern of thinking and functioning and behaving. This is called personality disorder. Next question is the definition sorry defense mechanism in the phobia. Option given: inhibition, dissociation, distortion, and the conversion. The defense mechanism. One question is sure for your any types of PG exam. This defense mechanism, one times always repeated question are taken from first question and second question. In the psychiatric disease, there are different type of defense mechanism are there for their disease condition. Like if a patient have OCD, if a patient have OCD, O if patient have OCD, then defense mechanism of there is the reaction formation, reaction formation, undoing, and displacement, inhibition. Inhibition in the this is the OCD. If there is phobia, that means the fear of the something. So if you inhibit such a type of the condition, then phobia is removed. Like so inhibition. Another thing is the displacement. If anyone suffering from phobia of the robber, and if the robber is removed and displaced, then no phobia occurs. So the defense mechanism of the phobia is displacement and inhibition. Another thing is the like hysteria. Like hysteria, there is if there is conversion, that means hysteria of the conversion disorder. The conversion is the defense mechanism. If the dissociative disorder then this is dissociative disorder includes amnesia, fugue, okay, and multiple personality disorder, somnambulism. This included in the dissociative disorder, and so already named as dissociative disorder. So the defense mechanism is the dissociation. Another is, if there is hallucination and delusion, then the defense mechanism of such is the distortion. Another, if these delusions are especially for the grandiosity, and if the persecutory delusion, if there is the persecutory delusion, then projection is the defense mechanism, and hallucination and delusion, especially in the grandiosity, this is the distortion defense mechanism. In case of the persecutory delusion, there is projection is the defense mechanism. Another thing is if the impulse control then it is acting out, and if the neurosis, then it is the regression, especially and all the thing regarding this type of question already told. This is a list of the defense mechanism, so please make a note for such topic, due to this is very important for you. So the answer is exactly inhibition. Next one is if a person is asked what will he do if he sees a house on fire, then what is being tested in that person? So in that question, the person is tested for the judgment. What is his social judgment, test for judgment, response of the judgment, sorry. In that question, option is given: social judgment, test judgment, response judgment. So the answer will be test judgment. Why test judgment? Why not social judgment? Actually, social judgment evaluate personal judgment like intervention, but test of judgment in the all respect. In that test, asking the patient, in that test of the judgment, the patient is asking the patient what he would do in certain situation, like house on fire, road dog running towards you. This type of the question is asking. This is the test of the person and test of the judgment. So right answer will be the test of judgment. Next is the Typical change in problem behavior. So how many stages? The in that condition, the question is the stage of change for the problem behavior. Problem behavior. In that condition, problem behavior is divided into the 5 conditions and 5 stages. So the unsuccess in the problem based behavior, there are 5 stages are there. Stage first, this is called pre-contemplation. Pre-contemplation. In that condition, the unaware of their problems. That means this is the unaware of that condition. Second condition is the contemplation. Contemplation includes the aware about the problem, seriously they are taking how to overcome. This is the contemplation stage. First stage is the unaware of their problem. Second stage, contemplation. In that condition, the patient is the aware about their problem, so that overcome to that problem. Third condition is the preparation. Preparation includes intending to take action, have unsuccessfully taken action in the past year. If there is failure in the past year but action is taken in the present and successful action is the preparation stage. The fourth stage includes the action. That means modify their behavior experience to overcome this problem. That means the patient is experienced about the past acting in the preparation stage. Another stage is the 5 maintenance. Maintenance, that means the work to prevent relapse. That means the error the patient have, the men have the error which are removed in the maintenance stage, so that no relapse, no error have come in the. So the right answer will be the 5 stages are there in the problem behavior disease. Next question is the DSM-4 criterion for the depression. The DSM stands for the Diagnostic and Statistical Manual Disorder, and fourth indicates the addition. In that condition, the symptom for depression should be at least for the 2 weeks, and for the depression, there are the diagnosis for the depression is the minor depression and major depression. Minor depression, and the criteria for the minor depression, there will be the 2 to 4 symptoms present, and major depression, there will be more than 5 symptoms should be present. Then it diagnoses the minor or major depression. So the answer already 2 week. And next question is the what is the produced by the supersensitivity of the dopamine receptor. This is the simplest question, the dopamine receptor. So the answer will be the dyskinesia. Nothing can ask else about that. You already know the what is the function of the dopamine receptor and overactivity of the dopamine receptor. So right answer will be the dyskinesia. Another question is also drug of choice for the treatment of the neuroleptic malignant syndrome is the dantrolene, not beta, not central anticholinergic, and so answer will be the dantrolene. Already I have uploaded the video of the drug of choice, and in that already mentioned that the neuroleptic malignant syndrome, the drug of choice will be the dantrolene. Nothing can say else about that question, and that is the simplest question. You have to many times repeat revision of such type of the question. This is the question is one liner, and you have to remember such type of one liner so that you can see and easily respond such type of the question. Next question is the Wernicke's encephalopathy is due to deficiency of the folic acid, thiamine, ascorbic acid, and the pyridoxine. This is also a one-liner question. That means the already told thiamine deficiency. I will upload the Wernicke's encephalopathy. What is the disease? But in the brief, Wernicke's encephalopathy. What is the Wernicke's encephalopathy? And it is a presence of neurological symptom caused by the biochemical lesions in the CNS, CNS, especially where thalamus, hypothalamus, mammillary bodies, especially these three are major affected. So the you have to remember thalamus, hypothalamus, and the mammillary bodies. After exhaustion of the thiamine, exhaustion of the thiamine, and also this Wernicke's encephalopathy patient have the symptom of the beriberi, and this mainly occurs due to chronic person, alcoholic person. Okay, and the trieds for the Wernicke's encephalopathy is ophthalmoplasia, ataxia, and the confusion. Okay, ophthalmoplasia, ataxia, and confusion. These are the triads of the Wernicke's encephalopathy. So this is very important question, and another symptoms includes the lateral nystagmus, and gait of such patient Wernicke's encephalopathy due to alcoholics patient. So this is also a staggering gait, that if the patient taken alcohol, and gait of the such person like wandering. So this is the staggering gait, in that person. And the peripheral and polyneuropathy and pupillary disorder, so dysphagia, sleep apnea, epilepsy, all other are lactic acidosis, memory impairment. So many types of symptom are there, but which are important for you I have already told. So next question, so answer will be thiamine. Okay, next question is the Most common substance of abuse in India, many times repeated: tobacco, alcohol, opium, cannabis. So the tobacco is the most commonly used and most commonly asked in previous PG exam and always be asked in the future exam. So substance of abuse in India, tobacco. Okay. Next question is the effect of long-term levodopa therapy. The option is given: the facial ties, nightmare, end of dose effect, and all of the above. The long-term levodopa therapy, you already know about the long-term levodopa therapy. The effect will be the facial ties already present, nightmares already present, end of the dose effect also present. So right answer will be the all of the above. So this is the simplest question, so you can't miss it. Next question is the drug of choice. Drug of choice for the alcohol withdrawal. The question is asking about the withdrawals and alcohol withdrawal symptom, and this is very important. The question have answer given, option given: the metronidazole, disulfiram chlor, diazeperoxide, and naltrexone. If the patient has alcohol withdrawal activity and if patient has addict of the alcohol, so the patient, if the alcohol is removed from that person and person have some symptom of the withdrawal activity, this can be removed by such condition is the chlordiazeperoxide, not naltrexone. And naltrexone is for the dependence of the alcohol or opioid. So in case of alcohol withdrawal, you have always remember that the drug of choice is the alcohol withdrawal chlordiazepoxide, and for the dependence is the naltrexone. And the question, another question is given: opioid dependence produced. What is the dependence? You already know the dependence, that means the physical dependence and psychological dependence. All type of the dependence are present in the opioid. So the B of C option is the right choice. Already this is the simplest question. Next question is the term dementia precox was coined by. Okay, this is also the one-liner question. That means you have to remember such type of the question. I will upload the such type of the psychiatric discovery and the term for such condition. Due to one question is always in your screen in the future exam, due to one question is always asked in any types of the medical PG exams, the term coined, what is the discovery, what is the such thing, and any other thing. So the right answer will be the option is given: the Blair, Snyder, Fraud, Kraepelin. The right option is the Kraepelin. Next question is: erotomania is seen in option being schizophrenia, neurosis, unipolar mania, and obsessive compulsive disorder. Before going to the right option, the deal with erotomania. What is the erotomania? Erotomania, also called as the declarum Balt's syndrome. Declarum-Bolt syndrome. Erotomania. Erotomania is a uncommon form of paranoid delusion. This is a uncommon form of paranoid delusion in that affected person believed that the another person is in love with him or her or in higher state. That means these beliefs that the especially it is found in the female person, that if she looks to the another male person and she thought that he is loved with him, and another, that the affected person think that the another person is the of higher status. This is the erotomania. Someone psychiatrist says it is a disease, and someone say about that it is a normal phenomena which are for few hours or few days only. And this is the psychiatric disorder. The list of psychiatric disorder in which erotomania is seen is schizophrenia, major depression, and bipolar disorder, Alzheimer's disease. This is the list in which the erotomania found. Again I repeat: schizophrenia, major depression, bipolar disorder, and Alzheimer's disease. So the right option will be schizophrenia. Next question is the Apache second does not includes. Apache indicates there are 4 types of Apache score. Apache first, second, third, and fourth. First Apache score is used for the ICU patient, in which first in 1981 comes in 1981, second in the 1991. After that, the fourth latest Apache is the Apache 4, which are in 2006. The Apache indicates the Apache, that means acute physiology and chronic health evaluation. It measures severity of disease in the ICU. Okay, and component if you ask component of the Apache is, that means acute physiology. Next is the A stand for age, and C stand for CHE, stand for chronic health evaluation, and fourth is the urgency, urgency of admission in critical care. This is the component of the Apache score, and this is very important Apache score. And also the Apache second used Glasgow coma scale. Well know about Glasgow coma scale. So the question is not include acute physiology score, already the part, age, already the part, and chronic health evaluation, already the part. So the sex is not included in the Apache. Next, which of the following neurotransmitter are decreased in the Alzheimer's disease? Alzheimer's disease. Many neurotransmitters level are decreased in the Alzheimer's disease, and also other the psychiatric disorder in which the neurotransmitter level are decreased. So option is norepinephrine, acetylcholine, corticotropin, and all of the above. So answer is all the above. In Alzheimer's disease, if you talk about norepinephrine or noradrenaline, these are in the locus ceruleus. In the locus ceruleus, the level of norepinephrine are decreased. Okay. Acetylcholine are situated in case of brain, and I am talking about the Alzheimer's disease. So brain is involved, and part of the brain where the neurotransmitter are decreased are nucleus basalis of myelin, and this is responsible for the short term of memory, and due to dysfunctioning of the nucleus basalis of myelin, so the acetylcholine level are decreased. So the short term memory of the Alzheimer's disease affected person are lost. Next neurotransmitter are corticotropin, and another one is the somatostatin. Somatostatin are also decreased. These four neurotransmitters are decreased in Alzheimer's disease. The also other list are there, that the neurotransmitter decrease in the schizophrenia, depression, OCD, mania, autism. So many lists are there, but for their important is the Alzheimer's disease. So right option will be all of the above. Next one is the question is drug used for treatment of delirium tremens is the delirium tremens. In the delirium, many drugs are used. Antipsychotic antidepressant are used, but especially drug used for delirium tremens are the chlordiazepoxide, diazepam, and clonazepam. These three drugs mainly used in the delirium treatments. So search for the right option. Quetiapine, diazepam, chlordiazepoxide, and both B and C. So right option will be chlordiazepoxide and diazepam. Next question is hallucination is a disorder of thought, memory, perception, intelligence. It is a disorder of the perception. Okay. The question is SSRI should be carefully used in the young for the management of depression due to increase in. The answer is nihilist ideation, suicidal ideation, guilt ideation, and envious ideation. This is the question one-liner. So you have to remember such type of question. The answer is suicidal ideation. Next question is the immotivation syndrome caused by. Option is given: cannabis abuse, alcohol abuse, opioid abuse, heroin abuse. The answer will be immotivation syndrome. Simplest question and one-liner question. So you have to remember such type of question, that is the cannabis abuse. Cannabis, that means cannabis included marijuana, and Indian hemp plant, that is also called as bhang. Okay, hemp plant, also known as the cannabis sativa, you already know. And from hemp plant, the bhang, ganja, hashish are prepared. It is a psychoactive substances, and in that the active substance is the tetrahydrocannabinol. Many times asked. Tetrahydrocannabinol, THC, are the active ingredient or psychoactive substances present in the cannabis plant, which are responsible for the motivational syndrome or other hallucination. In the cannabis toxicity, some important complications are like, for the I am talking about the cannabis abuse. So the some complication include: first, a motivational motivational syndrome. A motivational syndrome, that means loss of interest, reduced drive, and lack of ambitions. It is the amotivation, that means loss of motivation. This is the amotivational syndrome, which are complication of the cannabis toxicity. And another is the running amok. The question is asked that running amok, running amok or run amok also called, it is the a psychiatric episode where he goes on the rampage, destroying things and kill other. This is the running amok. And other is the flashback phenomena. Flashback phenomena, that means recurrence of experience of cannabis use. That means person experiences the features of cannabis use without actually using it. Flashback phenomena is also seen in abuse of hallucination, LSD, psilocybin, etc. This is the flashback phenomena. And also other is the ham insanity or cannabis psychosis, etc. are there. And the toxicity, if we talk about the cannabis toxicity, the cannabis toxicity affect the person, and there is increased heart rate in there. Heart rate is increased, and also there is increase appetite, increase in appetite, and dry mouth, and also euphoria, and derealization, depersonalization, synesthesia are there. So this is main toxicity asked in the PG exams. This is very important cannabis abuse.